So we're going to accelerate the distribution. And what we're going to do is add new distribution networks to supplement the hospitals. Again, the thought with the hospitals were that's where the healthcare workers work. That's where the healthcare workers are comfortable. But we're not pleased with the rate of distribution, so we're going to supplement the hospitals with additional networks. We're now recruiting and organizing thousands of new providers. The larger distribution network will include private doctor networks, what's called FQHCs, county health departments, ambulatory centers, this is the urgent care, city MD, et cetera, and the pharmacy network. There are 5,000 pharmacies in the state of New York. Pharmacies distribute the flu vaccine. They do this. They know how to do this. We have 1,200 pharmacies that are already committed and will be ramping up next week. And we'll continue to use the hospitals also. But we're going to bring in a much larger distribution network to do this. 500 pharmacies will come online next week. And we'll have hundreds of additional distributors coming on next week. On Monday, they will begin accepting reservations for vaccinations. I'll discuss in a moment. This is a very large group of people. And it can't just be show up at the pharmacy. It's going to be much the way it was with COVID testing. Go to a website, find out the location nearest you, make a reservation, and that will happen on Monday. The network will distribute to 1A and 1B. The new providers must prioritize their healthcare staff. Why? The same reason 1A is a priority. We don't want a nurse who is COVID positive treating 100 patients a day. Healthcare workers can be super spreaders. So the new providers, pharmacists, vaccinators, et cetera, get your people vaccinated first. Hospitals continue to prioritize the unvaccinated 1A. Because, again, we have to get those healthcare workers up to at least 70%. So keep them as a priority. The large union groups that have the ability, I'm asking them to attempt to organize their own administration of the vaccine. Many of the police departments I've spoken with, they have EMS, they have EMT, they have medical offices. They can administer literally their own vaccine. Fire departments, the same thing. They have EMS, they have EMT. Many county health departments can administer for their police, volunteer fire, et cetera. So whenever we can get a large group to have an alternative distribution, that's good because it relieves pressure on the remaining distribution network. Transit workers we're speaking with, if you have a provider network that you work with, which many large unions do, then let that network do the vaccinations, teachers union, et cetera. So wherever possible, we want to get those distribution mechanisms segregated. The local health department, in those cases, will give the police, the fire, the teachers, correction officers, an allocation on a weekly basis. And then, to the extent they can take care of themselves, fine. If they can't, fine, we'll take care of them in the larger network. But to the extent we get groups to organize their own distribution, that will free up the distribution mechanism to focus on the largest group in 1B is 75-plus New Yorkers, 75 years old and older.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.